Mental health refers to your overall psychological well-being.
Mental illness, as the brother was saying, has to do with the way we feel, the way we behave, and the way we act. Okay. High fever is when someone has extreme temperature. Okay. So when your temperature is above normal, you start to feel some heat within yourself.
Okay.
You understand? And then headache sets in.
If you are a bad person, if they leave you alone, people don't even want to be alone. They're afraid of their own thought.
When our mind is not in the right shape, everything is just not going to be right.
Change yourself by renewing your mind.
Our mental health, we have two main categories. Acute, which is for a short time.
Period, okay.
Yeah, and we have the chronic. Stigma against people living with HIV/AIDS. And then mental health is really killing a whole lot of people, even more than the condition.
So mental health is a really big topic in this generation because of the stress and, a whole lot of other issues that are going on in the systems in Africa. And today we feel that we should have a conversation around mental health. Thanks so much for joining us. My name is Prince Amdan. Today I have with me in the studios my dear to my far left, Ibrahim Yunus, the motivational speaker, world-class speaker to my short left. And then we have Mr. Bauer to my immediate right. He is a mental health officer, right?
Yep.
And he is going to also help us with the discussion because he's a professional.
Yeah.
And I'm super excited to have all of you in the studio today.
We are happy to also have you.
Mental health, mental health has become particularly very important because of how things are structured in the society now. When we say mental health, what actually is mental health? You being a professional.
Okay, well, I just want to take this opportunity to thank Mr. Prince and his crews for giving me this opportunity. Well, everything we do about this life is all concerned in our mental health. Yeah. And so when we talk about mental health, according to World Health Organization, mental health is a state of well-being whereby an individual is able to realize his or her abilities, okay, and is able to take care of normal stresses of life. And not only that, he or she is productive, fruitful, and is able to contribute meaningfully to the society. So, for example, when I was coming, my friend was telling me what you guys do here. Realize your ability. You are able to cope with the normal stresses that you go through in the studio. You are able to produce something meaningful to the society, and it has a contribution to everyone's life.
Okay, so that's the general well-being of an individual. Okay, all right, my dear. What do you think mental health is?
Well, to me, hello everyone. Nice meeting you again for this episode. Actually, what I thought, I didn't hear from an expert, but what I thought after looking at the topic was that mental health is about your state of mind. It's about your ability to think like normally, not to do things that we would say or people will refer to as what you are doing is abnormal. Like they give a question mark to what you are doing. So God forbid, if I start working on my two legs, my hands and my legs, people will see it to be abnormal and they will say that I have a mental problem. So I thought, or when I was thinking about the topic, I was like, mental health is just about your well-being. It's about how creative, it's about how good you are in every decision you make, how productive you are in the system. So that is what I think mental health is about.
Ibrahim is a lot of people think that mental health has to do with people who are not in good mental health, are people who are roaming naked on the streets. In your research, what have you seen to be mental health?
Yeah, thank you very much for this platform, for you guys creating this platform to create such awareness. In a society, we find ourselves in a kind of society where a lot of people are suffering. Not necessarily somebody walking naked. Like somebody can be cool, okay, even at the workplace, and the person mentally is not okay. But when I was doing my research, they said that mental health includes our emotional, psychological, and social well-being, and that it affects how we think, how we feel, and how we act. It also helps determine how we handle stress, relate to others, and make healthy choices. Trust me, the whole human body health depends on the health
Your
of the
mental
mind.
health, yeah.
The body is a slave to the mind. If the mind
Stops.
is if you see, your hand can have a problem. If your mind is okay, you don't really have a serious problem.
Absolutely.
Your legs can have a problem. If your mind is okay, you don't really have a problem. If your legs and your hands are okay, but there's something wrong with your mind, that is a serious thing. So actually, the enemy even attacks us from our mind. So if you want to change your body, how you feel, it all boils down with what are you feeding in your mind. So when we continue, we'll add some of the things one could do to really work on the mind. Even biblically, that change yourself by renewing your mind. You can't have any good changes within your body without really it starting from the mind. So the mind is, as a man thinks, so is he. You are the way you think. So the mind is very, very important. What you put in your mind, what you expose the mind to, is very, very important. I understand there are situations the body to have control over the mind. There are situations, but then when the conscious mind is exposed to certain things, it feeds into the subconscious mind. It's stored in the subconscious mind. After a while, it is absorbed within the body. Then the body now start to suggest to the mind. Exactly. Even before I can raise my finger, my mind has to tell this finger to raise it. So the mind is very
Basically,
powerful, and that is where a lot of, when you are not mentally healthy, you cannot be physically, emotionally, or psychologically healthy. This is the little I have to say.
So, with what Mr. Eunice is saying, basically, we all have to know that our mind is like an engine. Without an engine in a car, it won't move. The engine supplies all the essential needs of the vehicle, or let me say, of the motor of the car. It tells the car that move before it moves. If a fancy car is here without an engine, it is useless. So if we are human beings and we don't have brains, we are useless.
Or if the brain is faulty.
If the brain is faulty, we cannot perform good things, or we cannot perform actively or productively. So basically, that is what mental health is about. So even if one boat from the engine is loosened, you would see that the car would malfunction. You would see that the car would have a sound. Telling the owner, or telling the one driving the engine, or you, the one outside seeing the car moving, will know that there is something wrong with this car. So the engine has to be okay for you to see the car and say, wow, this is a wonderful car.
So in addition with that, how we handle stress, there's a healthy way of handling stress, and there's unhealthy way of handling stress.
Okay.
So from the way an individual handles their stress, you can determine this guy is facing a mental issue. The second is how we relate to others. There's a healthy way of relating with people. People with mental health issue, the way they relate with others, you can easily show this guy is deviating from the norm and other things. And another to make healthy choices. From the choices you are making, one could deduce from that this guy has a mental health issue and other things. So that
Bao, you are an expert in mental health.
Yeah.
We sometimes hear that this person has mental health issues, but he hasn't gotten to the point of getting mad, which tells us that there are different types or different categories of mental health issues. Can you tell us these types of mental health problems we have?
Well, mental health, just like the physical health, as one can be sick of malaria, diabetes, hypertension, so many categories of it. Yeah. We also have, as in the case of mental health and mental illnesses, we have different categories. We have depression, we have mania, we have major depressive cases where you could call some of them bipolar. One having depression at the same time having mania. Mania is when the person is irritable. He is just doing his or her things aggressively, and sometimes they are dressing where they want to look bright, doing so many bright things, wearing bright clothing for people to know that they are fashioned. Yeah, and then when it is depression, the person has low mood. Yeah, the person is not able to enjoy the previously things that he or she used to enjoy. You understand? He loses hope, feels like committing suicide, and a whole lot. So when it's two like that, we call that bipolar. And that before somebody can be said to be mentally challenged, just like my brother was saying, the person might, in my definition, or using the World Health Organization, the person, one of the key elements in it is that the person must be able to realize his abilities. Yes. While he realizes his abilities, he should be able to take care of the normal stresses of life. Maybe I went to workplace, a whole lot of things on my decks. I'm not able to do it. I'm not able to do it, and because of that, it's putting some pressure on me. If you are not able to keep all of these things, it can lead to another thing. Which
a mental health issue.
Yes. Which so our mental health, we have two main categories are there. Acute, which is for a short time.
Period, okay.
Yeah, and we have the chronic,
Okay.
which takes you chronic. Our conditions is a lifetime condition. That is why we advocate that you keep yourself, that you don't get it.
So you keep
because when you
yourself sane.
when you get it and you get to the chronic stage, you have to be on drugs for the rest of your life.
Wow.
Yes. So
Wow.
there are a whole lot of them.
Because I think I have a similar case where when I'm not able to do what I'm supposed to do, I get a lot of anxiety.
Yeah. You see, anxiety is part of our life. Fear, everyone has fear at some point in their lives. Okay. For example, I have an assignment to do in school and I'm not able to do the assignment on time. It means that I'll be so anxious because the lecturer or the teacher will want to have his assignment on that particular date, but I am not done with it. So when it happens like that, you are so eager to finishing this assignment. And then this anxiety that you have within yourself could even make you distracted and you are not able to do the thing properly. Mind you, sometimes pressure can cause us to do things as quick as we want. There is another aspect like that.
Yeah.
Yes. And so when anxiety sets in, as we discuss, we'll talk about some of the coping mechanisms that one can do in order to overcome this. Yeah. So when you are anxious, there are so many things you have to do. But I think in this discussion, we have stages.
Okay.
Have from this place to this place. That's why. So it's a part of life. But if it is more or it goes beyond
The normal
level,
anxiety,
then we say, hey, you are going beyond your limit and you need to seek for help. Yeah.
So what do you mean to say is that these things are part of life?
Yeah.
But when it gets to a certain level, then
Yes.
that is where it becomes a mental
Yes.
health
When it gets to a
concern.
particular level where you are not able to do your daily activities productively. Yes. For example, if you are so anxious that you can't even take your bath, you can't even wash your clothes, you can't even eat, you can't even sleep.
You have
That
the
it-
fear of
you
everything.
Feel like fear of things that maybe this particular thing that I'm doing is not going to work out well. So when it happens like that, you need to seek for help. Yeah.
Okay. All right. Do you have something to add?
Mr. Yunus.
I was looking at some of the causes of mental health problems. They say childhood abuse, trauma, or neglect. How you are raised from the home you are coming from can also contribute. When children are growing, some find themselves with parents that are showing kindness, love, and appreciated. So some of these children are raised with a good self-esteem about themselves because they felt loved, they felt cherished, they felt cared for. Now there are other crop of children that are growing up, they felt unappreciated, they felt unwanted, they felt not cared for, they felt neglected, malnourished. So in terms of, and anyone can experience mental health problem. Anybody, whether it's a child, an adult, anybody, no, presidents even experience. So mental health disorder is not limited to certain people. Now, when these two children, one from a loving home feel appreciated and another one is from a home feeling unwanted, these two children growing up, definitely the other one is more likely to be exposed to more of mental health problem because he has problem with even how he sees himself, the self-esteem issue. The second is isolation or loneliness. Usually when you even society or even nationally level, if they really want to punish somebody, sometimes what they do, they will isolate you, they'll just put you in a prison and leave you alone. Sometimes being alone, you start thinking, you start having certain thinking. So there's a way of punishing people. Just isolate them, just put them alone and lock them alone. Mentally itself, such a person can also experience some of these things. So isolation and loneliness, social isolation and loneliness can also bring about this mental health issues. Another thing is experiencing discrimination and stigma. Experiencing this discrimination. Maybe you, as my brother was saying, sometimes there's a deadline for you to come to submit something. Now the time is there and you are not yet done. I remembered when a colleague of mine was doing his master's program, his project work, the supervisor needed it within a short period of time. He was not able to do that. Look, that kind of, the guy was frustrated. He will be inside alone thinking so many issues. But when the problem was solved, it's like he just gave birth. Basically, so that kind of pressure. Now another thing is that discrimination, whereby you really feel like I deserve this work, this job, my capability, everything, I deserve it. And just within your eyes, you just see it is given to a different person just because of the person tribe or the person race. And you know if you get this thing, it can help you and your family and other things. And maybe your whole life you prepare for that. So some of these things can easily default someone into that mental, emotional, and other things, basically. Okay. So sometimes the bereavement, losing a loved one. When I lost my mom, trust me, I fall into the mental depression. As he said, there's acute one and there's the chronic one. As for the acute one, we all fall into it. When I lose my mom, trust me, I was hurt deeply. I was really hurt. At time I could be indoors alone. I will think about it for a very long time. But then there are certain habits you should do to help you cope with mental. So if you're not able to cope it, very well, that is where it will lead to. But as for mental health, everybody is going through. But even the mental health expert, they also go through mental disorder.
I'll ask you.
So that is how it is. Basically.
My dear.
Yes. So my brother mentioned about isolation. We would all agree that sometimes there are some people too, let me say, they are normal. But for them to critically think or make an action or start something, they always want to be alone. They can be alone, think thoroughly, make decisions, write down. Some people, when they are alone, that is when they are able to focus and then make their decisions, make decisions for themselves. Some people, when you think you are punishing them by locking them up, you are rather giving them the chance.
I think that's not the kind of loneliness he's talking about.
Yes, that's
there are
not
people when you want to be productive, you desire to be alone. But then after that, we need to have a balance of things.
That kind of alone, there's a term we call it.
I want to actually come in here because I wasn't asked yet the causes. I didn't want to go in there. That is what we call social withdrawal or withdrawal. Okay. Mhm. You don't want to associate with people, your peers, your friends, your family. You just want to be alone. So the moment you begin to withdraw, initially that was not how you were.
Yeah.
Understand? So the moment you begin to withdraw yourself from even functions you used to previously
Associate with.
enjoy, or some of the people you normally go out with friends, for example, you are in this studio, you go out together, you do this work together, then it came to a time that one of you do not want to associate with you again. He withdraws virtually in every activity or activities that you are doing here. This is the kind of this thing they use loneliness. It's a general. When you go to Google, they will give you. I mean, the person who also kept it there. Most of them are not experts, so they put the. We have our own terms too. Yeah, and with that, it's just one part of a mental illness that definitely one could be going through these things, and then we term it into that. Just like he was saying, losing a loved one, maybe finances and taking care of your kids, your family, and a whole lot. These are some of the predisposing factors that can lead to mental illnesses. But some particular mental illnesses, we do not have what exactly caused it. So that is why we say there are certain things that will predispose you to getting that. So maybe if you do this, you are likely to get it. If you do this, you are likely to get it. So many factors comes together, give you that pressure, and result you into having these mental health conditions. So just to add something small, when we are dealing with mental issues in a professional way, we come to a level where we have to talk about the biological cause, which has to be with maybe bacteria, genetics, environmental, and a whole lot of things around us. Yeah, so we take into consideration. I just don't sit in my office and then they bring a mental health ill person. Then I just write and then give the person drugs to go and take. No, you run tests. Sometimes malaria. You can be going through malaria and you think that you are mentally challenged. I will see when the test comes and I say, "Oh no, it's not my." This I refer to the person to a medical professional, and he takes care of the malaria, and it's gone.
So, in other words, you're saying malaria can make you like withdraw. Aside from the normal symptoms, we know that malaria make you go through. Like normally, everybody knows malaria will make you feel down. It will make you like vomiting. Some people have their own because of their body or whatever genetics they have. When they have malaria, they respond to it differently.
Yeah.
But normally we see that we have headache, wanting to vomit, you are weak and all that. So with what you just said, malaria can also make your mind malfunction and you would have challenges performing your normal stress aside from the normal symptoms that we know.
Yeah, we have a particular malaria we call cerebral malaria. Okay, it affects your mind. Okay.
Cerebral malaria.
Yeah.
Cerebral
So
malaria.
when it happens like that, okay, and let's say that something you feel so uneasy, okay, you feel sometimes because of the headache you are going through, you may feel so aggressive sometimes. Yeah, when it does happen. I'm not saying all malaria. I just mentioned a particular type. It doesn't really happen that way. Okay. So that is why I'm saying that when it does comes like that, because of the abnormal behavior the person may exhibit, someone or
It
you a
doesn't just
relative,
mean that
yes,
it means that the person
you the
is
relative
suffering
may
mental
think that the
health
person is
issue.
mentally ill. But then when they run and it's that particular malaria and they treat it, the person is fine.
Rather than just accepting the person as a mental because
yes.
they brought the person
That is
as
it.
Okay.
I think he's trying to say that he being the aspect or they being the aspect, don't just accept people as mentally ill
Yes.
because they just brought them as mentally
You do
ill.
tests.
Just like when you start having some headaches and stuff, you don't just go and say I'm suffering malaria and they start to give you
Yes,
malaria
no.
medication. They still have to test and be sure that this is actually what you see. I mean, you are talking about.
Yeah.
So I think that's the point he's trying to make.
And so when you go to, especially when you go to the clinics or hospital, and then a physician or a medical officer is actually clerking you, and then he wants to know what is wrong with you. He greets you, he introduces himself, you introduce yourself, and all that. Then he asks you what's wrong with with you, and then you say, "I'm sick of malaria." He will say, "But you know you are sick of malaria. What do you want here?" You understand what I mean? Yes. So when it comes to mental illnesses, it is not only the physical. Mental illness, as the brother was saying, has to do with the way we feel, the way we behave, and the way we act. And basically, all of this is about the mind. Yes. And so the causes are things that can be pertaining to your family lineage. Maybe your father was having it, your dad, or maybe your grandparents were having it. You are likely to get it. So genetics is very important. Your environment and other things, like going through childhood training, bringing up, all of these things are causal factors to getting.
And there used to be this
illness.
thing called high fever.
Yeah.
And we used to hear, like, there are some people who have it, and it's like their parents or
Yeah.
their
They'll
family.
say he has high fever.
High fever. Can we associate high fever as also a mental health
No.
or mental illness?
No.
Okay.
High fever is when someone has extreme temperature.
Okay.
Okay. So when your temperature is above normal, you start to feel some heat within yourself.
Okay.
You understand? And then headache sets in. A very high level of headache you experience. So when it happens like that, you become so confused and you become so agitated, irritated. And the moment you begin to do that, that is why when you come to the hospital and you are in this particular thing, they do test immediately to get you some medications that will calm you down. High fever is not a mental health condition. Or it cannot, no. High fever is a medical condition which needs medical treatment. For example, we are sitting here. When Corona came, if you were having temperature higher than a particular level, they see you as being a suspect of having COVID. Because temperature rise in a person shows that the person is not in the right state of the health. 37 and above is not agreeable. And when your body becomes warm, you see the kind of experiences we all go through. So when it is high, that is when you begin to feel and you begin to behave abnormally. And a whole lot of people would think that you are a mentally ill.
I want to come in here.
Please, let me come here. Sometimes the sickness is there, and the fear or worry of the sickness sometimes can even escalate the real sickness. I've observed people who never knew they were HIV/AIDS, and I watch how they relate with people emotionally, how they feel about themselves, their self-confidence, and how they relate with people. But immediately they went and realized they have HIV/AIDS. The condition is there, but the mentally, the worry, the thinking, the fear just make the thing another level. It's good, you should be aware of it, but once you get aware of that, mentally you can experience certain worry, certain pain. I think you can get some help from that kind of thing. Another thing is that when you take drugs and you don't believe in that drugs, sometimes it might not work. You need to have faith mentally. You must believe that if I take this, it will work. So it also helps in the cure of the situation. So I've realized that sometimes when you have just a medical condition, and mentally the worry, the fear is also is adding up to how you feel. I realized when this COVID-19 came, Elon Musk came and said that sometimes even like the way we are hyping it, the news and other things, is even causing more problem than the real issue itself. So sometimes lack of education, awareness, and other things can make people make the thing to be bigger than the way it really is. Exactly. And I've seen whereby somebody was in a place, they told him that place the temperature is very high. Although it wasn't like that, but it was made aware to him that the temperature there is very high. So it was Joel Austin who was giving that story. So he came out from the work only to realize that they locked him mistakenly. He was inside very worried at this high temperature and they left me. He was very worried. After a while, that he died and he wrote a note that it was how high the cold is that killed him. But that when they sent him to the hospital and checked, they realized the temperature wasn't even like the way he thought it was. But because mentally he feels it was like that, he actually killed himself mentally. So it's one thing having that condition, and if you don't know how to manage and handle it very well, I think that is where it starts to affect your mental thinking, how to deal with the situation. That is where experts like this can come in to also assist you.
Okay.
Yeah.
So if
to make a point.
Okay.
No, let.
if you
Okay.
can.
Just to say to what my brother has said.
Okay.
You know, I also happen to work in an ACE unit at where I work, Tamale Central RCH. That's where I work.
Okay.
Now, you will see somebody coming in, you test the person, and unfortunately, the person is HIV positive.
Yeah.
Yeah. The person mentally, we have grieving processes.
Okay.
Yeah. And it's normal when the fellow or the person begins to behave awkward when they hear the
news.
news.
Yeah.
For example, in the case of your mother.
Yeah.
One, you will grieve. Okay. Now, in that grieving, one of the things you do is that you deny the fact that you are not sick. Or you particularly deny the fact that your mother wasn't dead. Is that not it? When you first heard the news. Yeah, until then you get angry. The next stage is when you deny, you get angry. You just now becoming angry and then talking in out. Oh, how? Why? Sometimes questioning God. You understand? Then you go to a state of what? Depression. Then that is where so when you come and you are diagnosed HIV positive, or even my own condition, you are tempted to deny that you don't have it. Another thing is that you get angry. Then you go through depression. After the depression, you now begin to bargain. You go through bargaining. Say, well, it has happened. What will I do to overcome? And that is that state. Then you now come to the fifth one, which is acceptance. You accept the fact that you are sick. So grieving processes. So you get to the acceptance. You will not agree to what somebody else is telling you as being sick or something else. So mentally, if you say your hand is sick and you profess into this hand that this hand is sick, my brother, you are likely from now till evening time going to get a default in your hand. The mind is the powerhouse of every individual. In fact, we are all looking great and handsome, beautiful here as a result of our mind. So when our mind is not in the right shape, everything is just not going to be right.
So at what point do we describe somebody having a mental health disorder? At what point?
Okay.
I felt like anything that affects how you think, how you feel, how you relate with people, how you handle stress, how you handle certain things, I felt like some could be acute, some could be chronic.
Yeah.
So I stand to be. I want to hear at what point are we saying this person is?
It's mentally challenged, right?
Yeah.
Okay. So this is what we do. According to World Health Organization, okay, in the definition that I gave, the person should be able to realize his abilities.
Okay.
For example, your ability is to sing. Your ability is to be a musician or maybe pastor, a teacher or whatsoever. If you realize that you work towards that. And then another thing is that you should be able to manage. So if you are not able to realize your ability, it's one of the factors. 2, if you are not able to manage normal stresses of life, that's another factor. 3, if you are not able to work productively and fruitfully, it's another challenge. For example, you are good at IT, and then all of a sudden you are not able to do anything on it again. You are not more productive on it. And the last one is you are not able to affect or to contribute meaningfully to your society. So when it happens like that, those walking on the street, we call them mad people. I don't call them mad. They are just mentally ill. The reason is that they are not able to realize their ability again. They are not able to manage with the normal stress of life again. That is why you see them dirty. They are not bath smelling. 3, they are not able to work productively and fruitfully. And they are not even able to affect positively into the society. So that is the point. If you get to the point of not being able to do these 4 key things I've mentioned, that is when you are mentally ill or dysfunctioned.
Okay.
So you can see those people on the street, all they do is they even cause chaos in the society if they are not well kept. Some of you will be riding on the street and you see the person walking on the street naked. He doesn't even want to give you way to pass. You are likely to even hit them, which can cause another thing.
So if I get you right, when you don't realize your abilities, when you are not able to take care of stress, when you are not able to work productively, and when you are not able to contribute meaningfully to affect the society, that describe you to be a mentally
challenged person.
Especially if you initially used to
do it.
Okay.
and
And all of a
you are
sudden
not able to.
do those things.
Okay.
So mental illness is just an opposite of mental health.
Okay.
Yes. So when you come, before we can diagnose that you are sick of this particular mental health condition, for example, schizophrenia, one, we have to see certain things in you. We'll go through your family. Maybe your parents, one of them would have gotten it. Maybe you are drinking alcohol. Maybe you were engaged in a police or court issues. Or maybe there were certain things that you did that you are so much confused about yourself that when people get to realize that you were the one who did this and that may happen to you. Now, in the case of schizophrenia, the person begins to hear voices, something like voices people are not hearing. You understand? He begins to, and that is, we call that hallucination. When you begin to hear, when you begin to feel that people are, somebody is actually going to kill you. Yeah. And sometimes the touch, the feel, the hearing, commands, you are hearing people, somebody is saying, kill this person, go and kill this person. Or somebody is commanding you, go and hang yourself and kill yourself. These are some of the things. And another place we also notice is the delusional aspect. The person begins to feel so highly of himself more than he ought to be. So, for example, I'll sit here if I'm mentally ill of schizophrenia. It's not only in schizophrenia you find this. I would say that I'm the president of United States when I'm in Ghana, Tamale to be precise. And I have this high belief. It means that this is what I'm going and this is what I'm doing and this is who I am. Some say they are Jesus Christ. Some say they are Muhammad. And so when you begin to see people going through these kind of things, then you now know that, okay, this is the condition the person is suffering from. And then you clack, and then you know the kind of medication you are supposed to give to your client to manage the person through it. And then when they take it consistently, they are able to get rid of the symptoms, but it's for life.
That's even better, because these are people who have been able to identify that they are going through some kind of mental illness. But there are most of the cases where people are in denial. You even tell him that what we think you are experiencing is mental illness. They will deny that. Oh no, they are normal.
It's normal for the person to deny. In our own case, we have something we call mental status examination, and one of the key things we look up to is insight. Do you realize that you are sick? Are you convincing yourself you are sick? And so most of our clients is the relatives that brings them. Unlike the physical, maybe you are feeling headache and then you get up and come. Our cases, it's not like that. The person himself, you are seeing him to be sick, but he doesn't see so. No. So he lacks insight into the condition. And so it's a point. And it's normal when you are sick and you have this particular denial. To us, it's normal. You don't have insight into the condition. And that should give us the clue that something is wrong with you. And what is wrong with you? Yes.
Okay. I have a question for you because I have a short story to back it up. Can the term high fever, like you described that it is the temperature that we describe as high, the temperature is too high, then we say it's high fever. You also mentioned that you can have high fever and start having headaches. Can those headaches cause the person to go into a mental disorder?
You see, getting into mental disorder is not that easy. Okay, yes, that's what I would say. You know, when you begin to experience some pain in you, okay, especially when you are going through a state of headaches, you feel confused. Okay, mentally you are not stable, but that doesn't mean you are sick mentally. It is that particular state you are in that is making you behave some way. For example, in our case, we have a condition we call epilepsy, which I hope you all have heard of it before. Most people outside think it's a mental condition, but to me and we professionals, it's not a mental health condition. Why? Because it's a medical condition, but the behavior the person exhibits in the process of experience, the seizures, the person, and the jerking and everything, the shivering, and the aggressive nature the person may be experiencing at that particular moment, somebody else is going to say that this person is mentally ill. But we know it is just the what? The things, the experience, the seizures the person is having. So the signs and symptoms that you are having in high fever doesn't mean that you are mentally ill. It's the signs that you are experiencing. So when they give you medications to deal with the signs, you are going to be stable.
Okay. So I asked the question because there was a lady in Wa who roamed the streets of Wa, let me say, barely naked because people were always covering her up sometimes. For about 3 months, she was in Wa roaming aimlessly. People were sleeping with it. These men that don't... See, the girl was very beautiful. Let me say, she had flesh, like she was the type that had body. She was physically like very attractive. If somebody catch her and bath her and wear her clothes, you see her and you admire her. But within the next 2-3 hours, she'll get herself dirty again. After the 3 months, we didn't see her again in Wa. Then all of a sudden, she came back normal. I said she was good. Little did we know that according to her story and the relative that came, because she was pregnant, so they said she was in Wa, but they didn't know that she had, we thought, or the men around said, this is a nice lady having a mental problem, and they were sleeping with her all around and got her pregnant. So when it came down, or she knew, or let me say, how will I put it?
When
After she came, she said she had high fever.
Let's put this right. When you say men in war, let's
okay. Sorry about that. Sorry about that. She had a let me say encounter with some people who were not also good.
Yeah.
So later on, when she came, she said she used to eat at my mom's place. Basically, when she roams and come around and she's hungry and we are there, she will stand that we must give her food. So mostly she eats there. So when she came down, or when the high fever came down, she herself organized money and went back to where she was coming from. She came personally to her and behaved that way for almost 3 months. It came down and she went back, got herself treated, and came to thank us and now told us that she has high fever. And mostly when it happens, they lock her up and give her treatment until she's okay. I want to finish. Okay. After that, then she goes back to her normal, whatever she's doing. But in her sense, she feels it is high fever. That's why we were saying that does high fever mean you have a mental problem?
Just as you're saying, a lot of the high fever patients or people I knew virtually behaved like
abnormal.
Yes.
Okay.
You see.
So what I'll have to say in this particular lady's case, you said she was experiencing that for like 3 months. Okay. Then it wasn't high fever. She told you high fever, but it wasn't. She probably was on our medications, psychotropics, because we have, for example, in the case of depression, before we can diagnose you as being depressed, it needs, you have to be in that particular mood, or you have to exhibit the signs and symptoms like low withdrawal, low energy, but not enjoying previously enjoyed activities, and you have to experience this for like 2 weeks before we can now diagnose you. And in the case of schizophrenia, you have to experience it for at least 6 months. And there are others, you have to experience it from 0 to 30 days before we know the kind of condition that you are going through. So that particular distance, I don't want to sit here and say that he or she was suffering from this particular mental health disorder, because I need to also sit down with her, know how it all started before I can know what exactly is wrong with her. But I'm telling you that it was not high fever. It was a mental health condition that when she went there, somebody maybe supported her to go see a professional. So she was on some particular psychotropics. Then she became normal. I am telling you, those people on the street, when they get relatives who bring them to the facility and they are kept on these particular psychotropics and they take them consistently, they are going to behave normal as we are.
The mental health, the high fever I talked about was the one that occasionally comes. So when it happens, the person starts to like behave very aggressive, and like when you even try to, apprehend the person,
they tie the person down.
So it will come for a couple of hours and then it goes. Then
we have something we call seasonal affective disorders. Okay, these disorders comes maybe a particular time in your life, and then another year when it's up to that time again, it comes.
But your point is that it's not high fever.
It's not high fever.
Okay.
High fever, when it is well managed, you may not experience it again. You understand? Just like I told you, this person went for a professional help, but she thinks that if she tells you she's mentally ill, the stigma that will be on her from people, she wouldn't like it. So she will have to say she's suffering from hay fever. For example, if she comes and she say, they said I was mad, what mind will you have for her? So the stigma attached to our conditions and people living with AIDS and mental health will not make the person disclose the status to you.
So they prefer to call it or say, I have high fever, for you to think that...
It's not like some... Professionally, nobody will tell you that you are suffering from high fever when you are not suffering from it.
But why do people term that kind of sickness, that seasonal sickness that happen as high fever? Because a lot of people out there think that people with these challenges, when they come in, they are aggressive, they behave mad or mentally ill. Then they say, the person high fever.
It's just a term the general public is using. Okay? For example, you didn't know you are possibly also calling it high fever. But to me, the person will come and maybe it's a mental health challenge. I wouldn't call the person high fever. You understand? So the public will call the person high fever until it is proven that it is high fever. And a medical professional, when it is a high fever, the person will tell you. In fact, in medicine, when you are a medical officer and you are not vexed in mental illness, you refer to a mental health professional. No matter your doctorate degree or being a doctor, if you are not specialized in it. So if you see that this is the way it is, when he see that it is the aggressiveness and other thing, he or she will quickly call a mental health professional. But in your case, when the person is in the house, you would think that because I've heard that when someone is going through hay fever, the person is aggressive, the person is diseased, is hay fever, then you call the person hay fever patient, which in actual sense is not.
You spoke about stigma.
Yes.
How much does stigma affect people in mental health who
Stigma.
have mental health illnesses?
Stigma is one of our major challenges in our care for those people who are mentally ill. Yeah. Whenever somebody is sick, okay, comes and then we give the person medication and the person is on the medication and people gets to know that, oh, this is the challenge the person is going through. They now tag him with a name. Some people don't even want to come closer to the person because to them, they believe when I get close to this person, I can also get that. And sometimes they insult those people. And the more you withdraw yourself from these people, the more you insult them, the more the condition will come.
Yeah.
Because the person will be thinking that nobody wants to accept me into the society. Yes. And the moment the society is withdrawing from you, my sister here, how will you feel?
You might get a condition.
You feel like you are nothing. The whole world is against you. And that is the reason why we entreat everyone. Even as I'm here, I'll take it as an opportunity to tell you that wherever you are, stigma against people living with HIV/AIDS and then mental health is really killing a whole lot of people, even more than the condition. So tell people, anybody could get mental health. So we have something, our own slogan, we say mental illness, it could be you. Myself, as a mental health professional, I am not free from it. We all that are dressed and we are here, we are not free from it. Anyone could get it. And so when you laugh at someone in his own situation, you are likely to attract it. Yes. And so we shouldn't criticize, we shouldn't stigma them, those people, we shouldn't stigma them. We should rather help them. So when somebody who is having mental health condition comes, it's not only the drugs we give. We advise or we give psychotherapy or psychoeducation to the parents, how they can help the person to be able to overcome this mental health condition. Because if the parents are not taking care of the person well, encouraging the person, treating the person just like they would treat any of the family members, you see the person relapsing. And relapse is when you are on the drugs and you are not taking it, and then the condition comes again.
Yeah, I have this case study from Kumasi. There's this guy, he's a radio presenter, very good. But then I think he started having this mental health issues. His way of dressing started to change. He stopped buffing. He can insult people, but he wasn't like that, basically. But prior to that, this a guy, when he dressed, he will wear suit and tie. When he's to greet, he will squat and greet you. He eats healthy. He speaks very respectfully. He's a very good radio presenter. But then he gets frustrated at a particular point. He needed something from the father. So many conflict in the home, the father and the mother issues, so many things. He started to go into alcohol, his friends, and then it led to the tank. He will not bath, he will just dress anyhow and other things. So I felt like initially I was thinking these are the areas that is leading to the extreme. So I wanted to ask my brother that if somebody have realized his abilities, you are working in a company, you are doing well, but at the office, there are certain things that are bothering your way of thinking. That doesn't mean you still don't think right, but you are worried there's something bothering the way you think. Then it affects how you feel. Then it even affects how you relate with your family, with your spouse and your kids. It's affecting you with that. But you are still, you've not gone crazy. You still know. So at that condition, what type of condition is that?
Okay. So
because I'm seeing two scenarios here.
Yes.
This guy is extreme. This guy is still okay, but he's facing this kind of things are affecting the way he thinks. Basically,
the thing is that in the definition that I gave, you don't say use one factor of the person. Let's say the person has realized his ability, and that is the radio presenter, and because he's still good at it, then the person is not mentally challenged. You don't say that. One thing we need to know is that the alcohol that is engaged in can make one get mental illnesses. So we have alcohol-induced psychosis.
I think I will come to the kind of things that can
Okay.
you can put in your system that can cause some of these things.
Yes. So in his case, because we'll come to talk about that, in his case, the alcohol that he's taken and what he's thinking about is what is making him that
But for
way.
me, I think generally there should be something that is triggering even the alcohol.
Of course.
And at the end of the day, it goes round to affect the entire cycle of your brain.
mind.
Yeah.
So
You s-
probably you might see somebody at work and you think that this person is delivering, but he's not actually on his A game.
Yeah.
I don't know if you get the point I'm
Yeah,
making.
yeah,
So
yeah.
like an issue might come from another aspect of your life, but affects like your entire, because it's the same mind, it's the
Same
same
mind,
brain
yeah.
that you use to achieve all of these tasks and stuff.
Sure, sure.
I don't know. That's just what I think.
That's right. Because in his case, you said the father, he was needing something from the father, and probably he didn't get it.
Yeah.
Okay, so he felt like in order to deal with the pain, alcohol will reduce the pain
Yeah.
or solve it. But alcohol will not solve it. It has its own medical issues it will bring. Alcohol, you can
what
get
I
a-
want to know is that when you start having certain thoughts that affect the way you think clearly, your clarity, it start to affect the way you feel. It start to affect how you relate with people. Just within a day or 1 week. At that stage,
Is there a possibility of mental?
so I want to know, in that condition, is that a mental illness?
Yeah.
Or
okay.
the person has to go to the another level, then we'll describe that person to be a mental illness.
You see, when I was beginning that, I said we have chronic and we have the acute.
Yeah.
Okay. Somebody can be psychotic within some few minutes or within some time. We manage the person acutely. I get me? Yeah. And if it is not managed, this brother you are talking about, so he could possibly be suffering from acute psychosis. And anything that makes you that it affects your daily activities. For example, you are not able to eat, you are not able to dress well, you are not able to do your normal daily chores, daily activities, you are suffering mentally. If that thing happens to you and it affects your life, it doesn't have to mean that maybe you are doing something perfectly, one particular thing perfectly, and the rest of the things you used to do, you can't do it again. Even if you are doing that one thing perfectly, you need to still seek for professional assistance. So the person could possibly be suffering from acute psychosis. I don't know how many number of months the person has taken the person, or I don't know. Normally, you can't just sit down and say this person is sick of this. You need to clerk or talk to the person deep. We can take like more than like an hour or two on our client. So ours is not like a medical this thing, malaria. I use malaria because it's the common malaria, and then you just do maybe some 5 minutes, he's done, he's prescribed a drug for you, go and take it.
I
and all
foresee that he was facing that challenges, but nobody knew until he start to dress anyhow, start not bathing, start talking what and what, stop acting. Then I felt like the mental health issue is in stages.
Yeah, of course.
That is what I'm beginning to realize. But a first stage could lead to second stage, then it will lead to the extreme. That is something I'm beginning to.
yes,
It's like it's a process.
Yes.
It's not like once.
Yes.
So
So,
just
so
have
there are.
some-
I feel like there are certain stages. The cure that it need might not be that too much because it can easily be managed. Then it get to a point. It's another level,
see,
basically.
We have the beginning of everything.
Okay.
Okay, everything has a beginning. Before you started this studio, you had a beginning. Probably you couldn't buy all these things at once. You had to do it one after the other. Our case is when the person begins to do this, he or she will not disclose to you. The thing is eating him up. But until you yourself begin to see the signs and symptoms. So sometimes when the person has insight into the condition, he knows that something is wrong with him. You are going to ask the person when it started.
And I think one of the things is
Yeah.
that mental health is quite different because you don't feel physical pain.
You don't
Just
no,
like
no, no.
somebody who might be suffering.
You are very
So it makes you resist
And-
more.
Resist.
Yeah.
From,
Okay.
I mean,
Yeah.
accepting
That
that
is
you
it.
might
you
be
are,
going
you
through
are,
this.
you are ill.
Yeah.
You
You get it.
understand?
But because it's malaria and other stuff are physical,
Yeah.
you tend to feel the
Feel
pain.
it.
So you run to the hospital.
Yes.
But mental health looks like it's not that,
Exactly.
physically.
Exactly.
And to just say this, somebody could be mentally ill and very intelligent.
Yeah,
And that
I just
is the
recently
challenge.
I
Yes.
I saw a case of one gentleman on Joy News,
Okay.
who actually had to even leave school
Yes,
because of
yeah,
you've seen that story.
The National
Francis-
Maths and
yes,
Science quiz guy. Yeah.
And that is that, and I understand he was very,
Very
brilliant,
brilliant.
very brilliant.
Is the thing is our body has some chemicals we call neurotransmitters. So these neurotransmitters are chemicals that works in the brain to give us our ability to think, our ability to talk, our ability to move our arms, our ability to actually know what to do and what not to do. So these neurotransmitters, when it comes to the case of dopamine, it's a neurotransmitter. This neurotransmitter is a transmitter that helps the body in its movement, helps the body in a sense of activeness. Okay, so now, if the neurotransmitter, which is called dopamine, is high in the system, it makes you behave much more than usual.
So if you were performing like an average of 70, you perform like 100 and above.
Well, when you are behaving that way, you will not probably sit in class. So grading that will not come in.
Okay.
The person is still, maybe there are some of them that have these particular problems in mathematics, memory. There are also some particular conditions of ours like that.
And there was this mentally ill man. Now I'm very careful because I don't want to call him a madman.
Yeah.
Because his case was to the extreme, and everybody could see.
Okay.
And a lot of people were attributing it to his overintelligence. I don't know whether that is actually, because they said and anytime he's working, he's actually working miles while walking.
Yeah.
You see, there is no anything like over intelligence.
Okay.
Yes, one is intelligence. That is it.
Okay.
Okay.
But that cannot cause
that shouldn't be like somebody is over intelligent, so the person is mentally ill.
Yeah.
That was why I said we have genetics. Okay, maybe your great grandparents, one of them was suffering from it, and that is why you are likely having the possibility of getting it. So when someone who is brilliant or is experiencing this, a lot of people will say that because he's so brilliant, because he studies too much, that is why come by him getting this particular condition. No,
It's not possible.
It's not possible that way.
Okay.
Yes, it's not.
Well, let's get to some of the things because now we've spoken about some of the environmental causal agents of mental illness. Now let's talk about things that we put in our body that can also cause mental health problems, because we've all heard that people who take certain things have a higher risk of getting mental health issues. For example, we've heard that people who take marijuana to some extreme can get mental health issues. People who take cocaine and other, just as you mentioned earlier, alcohol as well and stuff like. How true is this, and why is it like that?
Well, this is very true.
Okay.
Yeah. So we have a particular mental health condition. Because of the general drugs that the person may be taking, we just term it as substance-induced disorder or substance-induced psychosis or any other thing. Now, when you take in marijuana, it affects your brain. As usual, we will talk. When you take weed, so the weed is the marijuana, and then we have the cocaine. Yes. When you take these particular things, it goes to increase your ability. If I say ability, I'm not meaning a good ability to do something. Yeah. Sometimes people feel like when I take cocaine, I am stronger. I have the urge to do anything I want. And the reason is that it goes to affect the brain. And the moment the activity or the effect of the cocaine affects the brain, it induces you. It makes you feel like, you see them feel like they are intoxicated with it. And then some of them, they talk anyhow, and it makes them feel like those other people who are under their influences are actually like ants. For example, someone who takes cocaine, if it's right here and he has snuffed it when he was coming here, he will see us to be kids.
Okay. Ants to be kids.
Kids,
As
like
children.
children.
He will
Ants
see
like
us.
No,
children.
you see
He will
us.
see us to be children.
Okay.
You understand?
Okay.
He doesn't see anyone as higher than him. So some of these effects that they have, for example, those going on, the magicians, some of them want to take and be high so that when they go, the reason why they take it is that they don't want to feel shy. They want to take control of what they are going to do. However, it has a mental health consequence that it affects your body, it affects your mind. And then if you don't take care or if you don't desist from that act, you will suffer from a condition we call substance-induced disorder.
Okay. So bottom line is that it can cause.
Yes, it can cause.
Okay.
And in the case of alcohol don't only cause mental health conditions or disorders. It can also have effects on your organs, like your liver. You have
medical
hepatitis.
conditions
Yes.
as well.
So you see a whole lot of people walking around with big bellies, and then some of them are actually suffering from hepatitis, inflammation of the liver. Yes, because of their taking of alcohol. And so it does not only have effects on your mental health, but also on your physical health.
Okay.
But we are talking about mental health. And so our stress is on the mental health. On the
Do any of you have something to add?
Yeah,
Or to
me,
ask?
I want to know, like, what are some of the steps people should take?
Yeah, I think I wanted to ask about that, but I just wanted to see if there is anything
Yeah,
you want to
no,
add
ma-
before
no,
we go to how to manage some of these.
Normally, my brother was mentioning of this chemical of dopamine. I think we all need dopamine. Sometimes you don't even need to take any drugs or something like that.
It's
It
in
gets
us.
released. Yes,
It's a
you
nice
understand?
neurotransmitter in
Exactly.
adrenaline, serotonin, and all that.
Exactly. It
It's
makes
all in us.
you feel in a certain way, and during your action, sometimes even when you exercise, sometimes it releases this dopamine.
Yeah.
It's a certain feeling.
Yeah.
It's very important. So God in His own self naturally is in us. We release it to feel in a certain way. Now, unfortunately, some people are there. They are in a particular state. The dopamine is not yet there or is not released. So they take some of these chemicals to release those things. So there's a natural way it will come, and there's a way you yourself chemically you can take
induce it.
something to get those things. Now this is the problem. A time will come, the natural ability of it
It won't be enough for you
exactly
anymore.
because now you want more
Higher,
of it
more, yes.
and other things. So and another thing I realize is that there are people who take drugs, and as a result of that, it lead them to be have mental illness. Now I know people who are taking cigarette for a very long time. They are not mentally ill. They don't have any mental issue. And there's somebody who have never tasted, who is not even tasting those things, and he has a mental health issue. So there are several things that can lead to mental illness, not necessarily limited to taking in drugs and
No, but I think we
it
made
was
mention of
specific.
that to like things that can make you
Yeah.
prone
Yeah.
to
Yeah.
not
And
necessarily that it will
Yeah.
people everybody who's taking
Exactly.
it can
Exactly.
because we have different systems
Exactly,
and
that
different
how
lead
it
to that.
reacts
to
Exactly.
drugs,
And
yeah.
this is something many people take those drugs in order to do away from a problem. Like
Pain,
he has
yeah.
a problem.
The
He
pain,
feels
yeah.
like if I take this drug, at
The
least
pain with the
like this case study guy I'm telling from Kumasi, the radio presenter. Anytime he's into this kind of serious trouble, whether it's a financial problem, whether it's relationship problem, any serious problem, he's trying to overcome it. And he doesn't know left and right. He doesn't know how to solve it. Once he takes the alcohol or he takes those drugs, he's high. That big problem he sees to be little.
Yes.
But so they take you to do away the problem. But unfortunately, this is the problem. Once the high come down, you still face the problem.
You have to go back and take
so
it.
I recommend that you don't even take some of these things. You face the issue.
They always think that is going to be the solution.
Yeah.
But it is not going to be a permanent thing.
Exactly.
It's just so momentary.
It's not sustainable.
Yes.
Yeah.
Because at the end of the day,
you still go.
You get addicted to
it,
drug, and then
and you will have to take it whenever you are going through these particular things. So, as I think you are here to ask, what are some of the things we can do
to manage? So let's talk about
it.
this before we get to the management of those cases. Let's look at now, right, within our society, some of the things that makes people fall into some mental health issues. For me, I think what we were talking about earlier was, ambition, being over ambitious, and expectations. Because and I think we've spoken about that in our conversation. Wanting to achieve something so badly to the point that you don't when you are not able to even get there, then you start to feel a certain way. Yeah. The energy that your normal energy, diminishes.
Yes.
I think that is one of the things that can. So work-related issues.
Yeah.
You wanting to achieve something and not being able to achieve it, and not also being able to manage your expectations, makes you fall into, Mr. Eunice, I don't know whether you want to talk about marriage and relationship stuff that can also get us into mental health.
As a tutor, sometimes I find some of my colleagues, they kind of get bored in a particular work. It's so mundane.
Yes.
So let me say there's a job and there's your passion, like realizing your abilities, doing what you really want to do. So those are the job they already know, like when the month end, I'm taking X amount. And even 10 years, 20 years, they kind of fall stuck. That is something I'm beginning to realize. So you see, mentally, the person starts feeling bad. And if you think there's no future, that's a good today one. Becomes sour. So you start thinking, you start having problems and other things. I wanted to find out what's the difference between depression and mental health and other things. It's like that a particular state is not really mental illness, but that person is more or less like. So I wanted my expert to come in to differentiate between depression and mental health illness, so that then it will help me make my case well. At this point, maybe the person is mentally ill, or maybe the person was depressed. Because I know a lot of things that lead people, it affect the person, the way the person think. The person start feeling bad and other things. Yeah. So we call it depression or what? I would like to get that.
You see, mental illness or illnesses is a broad area of conditions, which depression is a part of mental illness. So mental illnesses is the bigger picture.
Okay.
Yeah. And then the depression is part of it.
Anxiety.
The anxiety, depression, schizophrenia, traumatic events and all that. Now, depression, one can be depressed for just a day.
Okay.
One can be depressed for just 1 hour, depending on the situation he or she is going through.
Okay.
But I can recall that I said, before we can diagnose you with depression, you need to consistently go through this act or symptoms for at least 2 weeks.
Okay.
So if you come to me and then you say you've been experiencing it for 1 week, I will not diagnose you as being depressed. Maybe I will just have to have a talk therapy with you.
So
and
it
then
has to be consistent for 2 weeks. Then you can now come to.
Yes. So the amount of time it has taken you or the duration is very important in our diagnosis.
Okay.
So this person who is been silent since morning, okay, just comes to my office and say, oh, since morning I've been feeling low, I can't eat, I can't do this and that and that and that and that. Then I just say, oh, you are sick of depression. No.
So what you mean to say is that depression for a day cannot be
No, it cannot be a diagnosed.
to mental
Yes,
health.
no.
Okay.
If you are feeling that low for at least
2 weeks.
2 weeks.
Okay.
If it is at least 2 weeks, I'll diagnose you and give you medication, give you psychoeducation.
Even,
So
and
there
even
are
if it
those
is not
who have done
consistent
that.
for 2 weeks, let's say, okay, today you have depression. After 2 days after, you have another depression. Maybe 3 days, like
So
that
2
for
weeks.
2 weeks.
You are
You can-
depressed.
Okay.
Yes.
So here, this is what I foresee. In sometimes you find couples in marriage, they live very happily. Look at the man who committed the suicide. What is his name?
Yeah.
The foreign guy,
Twitch boss.
boss. So this is a guy. Even the day before he committed suicide, he and the wife was just happy. They were doing things and other things. So just because we've not acknowledged a person is mentally ill does not necessarily mean the person is not mentally ill.
Okay.
As you said,
yes.
the person inside it might not think he's having that
yes.
issue. But I think anything that is affecting you and other things
You need
and
to
becoming extreme,
yes.
you should
This particular case of the man you are talking about,
yeah.
that he caused suicide.
Yeah.
The thing is that most people who want to commit suicide, they won't tell anyone. No.
Yeah, I'm happy you say most people because
Most
my brother just said somebody wanted to commit suicide and the
Most
person
people, they won't
told
tell
me-
you. The moment you know, they've already committed it. So somebody is walking around and saying and telling you that I want to kill myself. I want to kill myself. If he wants to kill himself, he would have done it. So this man, because of family pressure or the fear of the unknown, he's so anxious. Maybe I want my family to be at this particular state in these particular years, but I've been a doctor. I've not been able to achieve that.
I'm looking
Or-
at it from this angle. Sorry to bring you. I'm looking at it from this angle. His actions was influenced by the mind. He had a thought. That thought controlled him to act. So I'm feeling like that thought he was feeling for that short period of time to lead him into that dark state.
He has suicidal ideations,
Okay.
okay,
Okay.
which he didn't tell anyone,
Okay.
okay?
Okay.
And before he would have acted on this particular thing, he's been thinking about this for long,
Okay.
suicide. And he felt that I have thought and I think that the only thing that can solve this, my problem, is to commit suicide.
So can't mental illness lead to suicide?
It can.
That's actually
As I was telling you that
So we have one that is diagnosed and the one that is not diagnosed.
if you
Or
come to
until
us,
it is diagnosed, you can't conclude that's
when you come to us,
okay.
I will know whether
Okay.
you are mentally ill or not.
Okay.
But I
get
think
me?
the point he's
Okay.
making is that there is somebody out there who has the symptoms
Okay.
of mentally ill person.
Yeah.
But the person hasn't come to you to be diagnosed of actually having it.
Okay.
Does that mean the person doesn't have it?
Yeah.
The person walking on the street,
Yes.
you clearly can see that the person is mentally ill. So you yourself have seen that. But as to which of the mental illness, you don't know. But you have the mind that this person is what? Mentally ill.
Yeah.
I getting me. So just I mentioned something. You can be sick of a particular condition and you are hearing voices telling you to commit suicide. You are hearing something like, my boss is telling me to kill myself. And you are obeying it because it's your boss. You don't know what exactly is happening to you. You are feeling that that's the right thing. It can even, the voice could even tell you to, like if, for example, which I pray God forbid, I'm going through that. The voice can even tell me to slap my boss, to slap Mr. Prince.
Yeah.
You understand?
Yeah.
So this man has been feeling this. And I'm telling you, it's family problems. Okay, most of these things are family problems that makes them to go through this particular act. And we all know suicide doesn't solve the issue. It doesn't.
And I think on this platform, we've been trying to educate people about not taking suicide as as the ultimate.
Yeah.
Because there is always a lot to do.
Yeah.
There's always a lot you can do to, actually become
Overcome
better
that.
or overcome
Yes.
whatever problems you
Yes.
are going through. But then there is also the issue of people who, like, are not naturally, they don't have a certain kind of energy to be productive naturally. And these kind of people, like, rely on, let's say, certain stimulants to be able to be productive. Would you say these kind of people are also, fall within?
Yes, we have something we call borderline.
For example, let's say there are people who, if they want to learn, they have to take coffee. There are people who they want to sleep,
Okay.
they have to take some, something before they'll be able to.
Well, just like my brother always say, it's all a matter of the mind.
Okay.
If you feel sleepy when you are studying, relax yourself and sleep. Okay. Sleep and release yourself from that stress sleep will bring you. In fact, when you are feeling sleepy and then you don't sleep and you are sitting on your table to study, you are only deceiving yourself. Yes. You study and you not get anything. So relying on maybe coffee because you don't want to sleep, you want to study. I think I've tried that once when I was in university. I tried it once. But when I took the coffee, I was rather sleeping. You understand? It didn't have to work. My friend took it and he was able to study. He said,
if I take it, I will sleep.
The thing is that it's the mind. You can still take it. And
For lack
sleep.
of time, let's get to how to manage or how to, like, prevent yourself from getting into these conditions.
Okay. So we have prevention and then we have the curative aspect. The prevention is when you tell somebody maybe don't do this so that you don't get this. And the curative is when you give medications and treatment and other medical advices. So some of the things we need to talk to our young people, especially this particular part of the country, not only here, but mostly here, is that our engaging in the drugs, it should be something we should desist from, and the alcohol intake. Yes, it's one of the major things that causes young people here to go through mental illnesses. Yes, and another thing.
Is it that is what we see, or because me sitting down, not feeling any kind of uneasiness, wouldn't push me into. Don't we think that there might be some underlying reasons why people get into these kinds of behaviors?
There are always reasons why people do this. Yes. For example, somebody who is a scammer, he has a reason why he wants to take this particular drug.
Okay.
Especially in the case of these long vehicles that travels long distances. The person is having it in the mind that if I put something inside my maybe 5-star drink and I take it, I will be able to sustain myself till I get to my destination.
Yeah.
Yes, and they take it. They have very good reasons. To them, they take it. Some say they want to gain the energy. Some say they want to remain long hours. Some even take it because they want to perform.
But your point is that it's not helpful.
It's not helpful.
Okay, so let's talk more about the how to prevent or how to stop yourself from getting into.
One of the things you have to do is that when you are engaged in taking drugs, it's not good for your health. Maybe you want to stay longer nights to study, okay? And you feel like, let me take alcohol and let me take this. That will make me be able to study early. What thing you can do is that check your daytime, what you do, okay? Maybe in the daytime you are so busy, but when you close, you can take your time, relax your body, sleep small. You are going to regain your energy to continue in the nighttime for your studies. Yes. And also, when you feel like you are stressed, relax yourself, especially stress from workplace. When you get home, relax yourself, you have music or play music. If you can dance, you dance in your room. I mean, have self-realizations techniques. You just sit down in the house, quiet your legs. Some people call it yoga. You can just engage in that, meditate on positive movements of your day. And also, you can get into exercising your body, maybe running around in your room. And if you are a religious person, you meditate on your good book, and then you say some positive things for yourself, or maybe you are going to face a particular task. For example, when I was coming, I always believe in one thing. I prayed into when I was coming, that what I'm coming to do here, it should work the way I want it. My faith is that I can equally do what I want to do with a faith that, I say I want to come and do well here. So I tell God, this is what I'm coming to do. I'm coming to do it, and I'm going to do it. I'm ready for it, prepared anytime. So as I'm sitting here, my mind is already prepared. You prepare your mind beforehand on activities. And one of the things that helps us is religious activities. One of the major things, meditation, exercising. And
would you also say social inclusion?
Yes. Social inclusion. You get into yourself mingling with others. You know, all of these things are positive ways. Voicing out your problems to trusted individuals. For example, the man that went through the suicide, if he had disclosed this issue with a trusted friend, this trusted friend would have talked to him and even asked him to seek for professional. And a lot of doctors are committing suicide. Yeah. A lot of them, they have their work and pressure from home. So talk out your feeling. That is why God didn't create one person. He created two people so that when one is down, the other one can bring him up. So if you feel that the people around you are not of help to you, then I think actually you are not in this world. The world.
So I have, thanks very much for the education. I've really learned a lot. I have 3 things to say, and that will be my final submission. I think it's not always taking drugs, alcohol, those things that lead to mental illness. Sometimes you even taking those things shows that you have mental illness. That means that mental illness can lead people to do
that was
those
the question
things.
I was asking. Yeah.
So sometimes we saying the person doing this lead to the person mental illness. Maybe the person was already mental ill. That's why. Because if you are taking certain decisions, I should know that as a normal person, you shouldn't be doing that. So that in itself shows that that symptom as clearly shows that you have a mental illness issue. My second issue has to do with the solitude. If you're a very bad person, criminal, so what they do is that they leave you alone with your thought. Your thought will kill you. That's why they say if you do good thing, it's for your own self. If you are a bad person, if they leave you alone, people don't even want to be alone. They are afraid of their own thought. But when you are a clean, good person, you can have a positive thought. So as my sister was saying, I was focused on the solitude. No, she was talking of solitude, whereby you create you make time to come up with something productive. So that one, you are goal-oriented. But when somebody is a criminal, very bad person, kill people, look at how they kill some of these criminals. They will just leave them alone in the prison. Their own thought will kill them. So that's another form of solitude. Now, mental health refers to your overall psychological well-being. And in order to do that, my brother made us realize that there are preventive measures to do that. The first one is making social connection, which is very important. Some people are indoor people. They are alone. You don't even know what is happening.
That's the social inclusion
it's
we were
good
talking
you
about.
should try and make social
Even
connection.
if you are the introvert kind of person, at least find a social way or a social life once in a while. It boosts your self-esteem and it makes you a bit more.
And I have a friend, anytime he's indoors for a very long time, sometimes he gets headache. Like the race, you are just alone. Now, the second thing is stay active, exercise. I've realized that anytime I exercise, there's some goodness I feel within myself.
That's why I still
especially when I'm exercising and I'm playing music, or maybe I'm playing motivational speech. The way I have a way I run. The day I listen to Les Brown and the inspiration is high, I pass the random places. So these things inspire you. And another thing is that in the night before you go to sleep, You can listen to meditation. You can do journaling. You can do some affirmation. In fact, I have some meditation thing I normally listen to in the night. They'll just say something, I am worthy, I am this. It will just help you to have a good thought to go to bed. Because when you sleep, your conscious mind go to sleep, but the subconscious mind is not sleeping. It will still be doing certain things. So it's very good. You visualize whatever you want to do and other things, and have your sleep. The third, the third one is that have a friend. Have a friend to talk to. It's very good. We should all have a friend. Trusted friend. Anytime I have an issue in my heart, I need someone to talk to. Usually it's my lady, my wife. But days she's not around, or maybe certain conversation I don't want to talk with her, I have a close friend I call to speak to. Having that helps a lot, but just keeping it within yourself, you think I and die. So it's very good. It's very good you do that.
Okay.
And another is taking a walk in nature and enjoying sight and sound of the tree. Sometimes when you go to the sea, you just expose yourself to the nature. It's also help. Another one, take up a class, learn a new skill in areas you have interest in. A lot of people, when you have nothing doing, you die. You start engaging, thinking of some of these things. But once you have something doing, you are learning a skill in an area you have interest. You want to be a dancer, take a class in that. If you want to learn editing, do that. Singer, learn that. Those things are very, very important. Right. And take a day from 7 days to do nothing. Just spoil yourself. Take good care of yourself. Even God have a day for us. A lot of people, some people is doing nothing that lead them to mental illness. Others to doing too much lead them to mental illness. Okay. So it's good you should have a day for yourself.
So with the preventions that I was talking about, there are so many predisposing factors. Okay. So maybe just like he was saying, it's not only alcohol. Okay, so many things, biological things that can cause, make you get mental illnesses. Yeah. So because of our time, I would like to just talk about some few things in the curative aspect. Okay. So in the curative, we have medications for that. When someone is sick of mental disorder, we have medications for that. And then we also take the person through psychotherapy. Psychotherapy is a talk therapy depending on the kind of condition that you are going through. We have something we call cognitive behavioral therapy, which we say mental health is your psychological well-being, which has to deal with the way you feel, the way you think, and the way you act. So a CBT, or cognitive behavioral therapy, this one will make us be able to deal with your thoughts. When we deal with your thoughts, it will affect your behavior, and your behavior will affect your actions. So we also do psychoeducation to the parents or caregivers, so that when you go home, these are some of the things you need to do to your caregiver, and encourage the person and other things. We have occupational therapy. Those who are admitted, those who are mentally ill, and they are admitted in Ankafo and Pantan and other places, we teach them we give them occupational therapy to learn, just like my boss was saying, to learn a skill, to learn something productive that when we integrate you into the society, you will not go sit. Yes, you can happily do it. You will not be sitting idly, and then it can also make you relapse. So these are some of the things that I would like to say. Yeah.
All right.
Oh well. My last submission, basically, this is not my field, and I've just been listening, and I've been learning and taking in all the information that I know in the near future or within the next 1 or 2 hours.
You never know.
I never know.
Tomorrow, it could be, because we are all prone to mental health illnesses.
And I don't know.
And maybe some of us have even gone through it, and then we didn't know we were having mental health issues.
Yeah. And I don't know who I'll meet and then advise.
You can help,
So I'm very grateful for all the information I've gotten here. And I hope you, the one listening, you have also jotted down some few things or have taken in some of the words and things they have said. It is good we all know the state of our mind, what we are going through. Please try and then always listen very well. Take your notes and then write on the comment section if you want to know any other thing about what we are discussing, because I have learned a lot, and I hope you also learned a lot.
So there are
Brody,
people who...
Let me add this. Also, eating healthy
Yeah.
is very important.
Okay.
The food you eat influence your mood and
Yes.
how you feel.
Yes.
So it's very, very important you take care of the food you eat. And sleeping, have a good sleep. Lack of sleep can affect you very seriously.
Yeah.
When you've not sleep, it affects you mentally. So it's very important you take your sleep seriously. And then last one, at the end of the day, it's God who can really help us. Seek for that help from God. It's very important.
Okay.
Have a healthy relationship with the Almighty God.
Okay.
You help. you.
We've spoken so beautifully about, how we have to prevent mental health and all of that. There are a lot of people who are afraid that mental health there's a support system for mental health is not so great in Ghana.
Yeah.
There are not so many, facilities people can have access to.
Yeah.
So right now, when I'm sick of malaria, I know where to go. But when I start to have, mental health illness issues, I don't know where to go. Is there a great, or a big deficiency when it comes to, accessibility to mental health, facilities?
Yes. There are great lot concerns about that, in especially in the case of the facilities, the admissions, especially where I'm working. I don't have a place, even an office for myself. I don't have. I have to be perching with some other people, and sometimes I have to. If I get my client, I just have to go to a cubicle, cancel the person, and do whatever I have to do, and then I leave the person. So facilities are not there for us to actually run this.
Does it mean we
well.
don't take mental health seriously?
Mental health is not being taken seriously, and I'll say that it's all ignorance, because our mind is the powerhouse of everyone.
Wow.
Okay, so if we don't really take care of our mental health, and then we think the physical health is much more important than the mental health, it will always bring us to this particular state that we are in. And you see, if we want to look in the outside world, even mental health, we have problems globally, but Africa is just too much. And a whole lot of these economic issues that we are going through, and a whole lot. A lot of people are going through a lot of things mentally. But there are no big platforms where they can tell a mental health professional to go and talk to the public in these particular times. How am I supposed to do this?
Wow.
The little, I just take just some small money for salary. How do I manage this stress? I have to feed my family. I have to pay my kids' fees. I have to take care of my wife and all that. What are some of the things
And
I
that
can
alone
do?
can also give a mental health
condition. And these platforms are not there.
Yeah, there's something I like. You see, many people try to relate mental health with juju, like it's a spiritual issue. So this Kumasi guy I was talking of, the mother was treating the guy spiritually. The belief is that somebody is doing him. So instead of sending the person to they refuse to be that somebody is doing them.
Yeah, so that's
mental health issue really mostly it's not about spiritual. It's not juju.
Yes,
Somebody
because
is doing them.
there are no platforms for people to hear. They don't know there are people who are there to also take care and give them medications to also take and be whole.
Wow, amazing.
So it's like that. So
Amazing.
we don't have platforms
Amazing.
like that. Our medications, especially in this part of the country, northern region, is free.
Oh, okay.
And these medications are there. Sometimes they will be there and even expire. You want people to come, and they are not even patronizing. And that also boils down to the stigma. So we should know how to relate with them. We shouldn't stigmatize them. In fact, it could be any of us. And so if we get to that particular way, then I think it will help us. And the government and any other person, just like you are doing, you are helping promote the mental health education. And I'm so happy. I'm so happy. A lot of people that will hear this or listen to this, I believe will get to know about the state of their mind and probably seek for help when they are going through any of these particular conditions we're talking about.
Amazing.
I think
I think we also have to thank you
Can I
because
chip
our
in?
time is just
Okay.
come in just.
So there's a young lady who was telling me that I will give my mind to the guy. I'll give my everything to the guy, but I'll not give my body to the guy. And I told her that that's foolishness, because if a guy gets your mind, the body is cheap. Because if you get a lady mind, wherever she is, it's you she's thinking about, and she will definitely come and give her body to you. So mental health issue is a very important thing.
Very important.
We should make a provision for our mental health.
I think I'm super excited for this conversation, and I would like to thank you for coming to educate our viewers or our subscribers on this particular topic, because as I said, there are a lot of people who are going through mental health illnesses, but they are not aware.
Yeah.
So this education was very important, and for me it's much about the awareness.
Yes.
Because if I am aware that these are some of the things when I'm feeling, there is a possibility that I might be going through depression, I might be going through that, then I know what to do to get myself out of depression.
Sure.
Yeah.
I might not even need to come to the hospital, because it's not all of these cases that needs medication.
Yeah.
Some of them you just need to manage it, and then you'll be fine, especially the acute cases. And if somebody is not aware, at the end of the day, they'll even bring the person to the mental health facility, and they'll deny or they won't accept that they are going through any challenge.
Yeah.
So I think this episode has been one that I enjoyed, and feel that a lot of people will benefit from it.
Sure.
So thank you all for your submissions, and thanks for watching. Make sure you subscribe to the channel. If this has helped you, make sure you share for somebody to also benefit from, and that would help all of us. So I'd like to thank you for watching today's episode. See you in the next one. We out.